So one of the areas of a really excitement at the ASCO GI this year and for the past few years has been the cholangiocarcinoma world. We have found so many molecular targets in there, and it's sort of hopefully becoming the poster child for precision medicine in GI cancers. About 10 to 15% of them have FGFR2 fusion or rearrangements, most likely fusions, and there will be different partners, but we've seen that FGFR inhibitors work really well no matter what the partner is. It just has to have an FGFR fusion involved. There are many drugs that are out there. Pemigatinib is already approved in this setting. We saw the results of the phase 2 study of infigratinib, and they've also filed for FDA approval based on the data. This was a study of over 100 patients in this cohort who had FGFR2 alterations in cholangiocarcinoma who've had prior lines of therapy. In this study, there's an overall response rate of 23% in comparison to if you look at the pemigatinib data and the futibatinib, which is the Tayo drug. Their response rates are about 35%, but if you look closely at the data, the response rate is about 34% in patients who are getting this drug in earlier lines of therapy rather than later. So there's something to be said that if you actually use it sooner rather than later, it's really effective. Now, we also found that there's actually a different poster that was presented, but interestingly, the benefit of chemotherapy in patients who are FGFR2 altered is not different. So that's good to know that it's not that patients who are FGFR2 altered, it's not that they respond poorly to chemotherapy either. But nonetheless, this therapy is very exciting. It gives you a PFS of about 7 months, no matter all these drugs, all three of them that are out there have shown similar response rates and similar PFS, as I just talked about. It does come with side effects, phosphate imbalance, eye issues, stomatitis, but I think with a little practice, it's not something that will hinder us from using this drug very easily. And we're already using pemigatinib, and hopefully we'll get some results of the studies which are comparing these drugs to standard of care agent gemcitabine that will help us define if we can move these to even earlier lines of therapy.